I said for the UTI, you have the urethritis. So what will be the possible signs and symptoms of this urethritis? So the main symptom of urethritis, one of the main symptoms are dysuria. Dysuria. That is the main symptoms, and there could be, especially the males, there could be urethral discharge. There could be discharge. The males, there could be discharge. But the main urethritis, the main symptom will be dysuria. But in men or in males, there could be urethral discharge. If the discharge is as a result of gonorrhea, if the discharge is as a result of gonorrhea, it will be purulent. The discharge will be purulent. The discharge will be purulent. Cystitis. So for cystitis, the onset is sudden. Cystitis, the onset is sudden. And there will be burning or painful voiding of small volumes of urine. For cystitis, the onset is usually sudden. And it is also painful and burning, voiding of small volumes of urine. And it's also associated with nocturia, and it often comes with low back pain. Low back pain. It comes with low back pain. And the urine is often turbid. And there's also about 30%, there's also about growth hematuria. So if a patient is having blood in the urine, and the urine is dispersed, the blood is dispersed with the urine, then you should suspect that the source of the blood is coming from the bladder. If it's dispersed through all the urine, the blood is dispersed throughout the urine. So in the bladder, in cystitis, which is inflammation of the bladder, in cystitis, the onset it's usually sudden. And I'm saying that it's associated with burning or painful voiding. This maturation is of small volumes, comes in small volumes of urine. And there could also be nocturia, as I said. There could also be nocturia. Patient to be complain of back pain, of a low back pain. Low back pain is common. The urine from cystitis is often turbid. And I'm saying that there's growth about 30%. There's growth hematuria. So you could also have a low-grade fever. low-grade fever. One is from cystitis. So this is something about cystitis. So about pyelonephritis. Pyelonephritis. Pyelonephritis will also present like cystitis. Pyelonephritis also present like cystitis. So there could be chills. Typically, for pyelonephritis, there could be chills, there could be fever, there could be flank pain, there will be nausea, there will be vomiting. So you could be having these nausea, vomiting, there could be fever, chills, or flank pain. All these. Am I moving fast?
No, please.
Okay, all this is also associated with acute pyelonephritis. There could be also dysuria. There could also be dysuria in pyelonephritis. So these are some of the clinical manifestations. Urethritis mainly as dysuria. In the patient, especially the males, there will be urethral discharge. And if the discharge is from gonorrhea, it will be purulent. Mhm. If it's not from gonorrhea, it will be whitish and mucus. If it's not from gonorrhea, it will be whitish. Cystitis. We say that cystitis is sudden, occurs suddenly, and there's burning or painful voiding. And it comes with small volumes of urine. So when you're having burning or painful voiding of small volume of urine, then you need to think about cystitis. And it could also be nocturia. I also say that there's pain. Often comes nocturia and often comes lower back pain. Lower back pain. The urine is often turbid. There's also growth material. Growth material. Growth material. So there's also low-grade fever. In pyelonephritis, symptoms behave like cystitis. Pyelonephritis behave like cystitis. Hold on for me. Hello. So
Hello.
for acute pyelonephritis, I'm saying that the symptoms. So for acute, the symptoms are almost the same as cystitis, but That's one thing. 1/3 of the patients will come with dysuria. Dysuria, and there's also chills, fever, frank pains, and you have nausea, vomiting. So if a patient comes with that, then you should think about pyelonephritis. How do you diagnose this? So for diagnosis, you consider urinalysis. Normal urine, much culture is not much look, but you consider urinalysis. Let me ask you this: how do you take urine sample for? How do you take the sample for the lab? You want to take urine sample. How do you go about it?
So please, you take the midstream urine, you start peeing, then halfway through you catch the urine.
So you start peeing. What does so take your time and do it well.
So what I'm trying to say is that you don't catch the urine from the beginning when you start peeing, but you pee halfway through the process, then you catch the urine.
So you know, Benedicta, you know halfway. If you are peeing, you know that this will be the halfway. Do you know the content, urine content in your bladder?
No, sir.
So how do you check that this is halfway? You are not wrong. What you are saying, you are not wrong, but practicality. So you are not wrong.
Yes, sir.
How practical say that halfway? How will you know that this is halfway? So that is the first thing that you will do. So in answering questions, most of the time you leave some of the marks. And you come back and tell us that I've done it. I don't know why I've gotten low marks. How do you do it? How do you tell the patient to go about it? How do you?
He said you tell the patient not to catch the first urine that comes because the urine will.
What is the first thing to do? What is the first thing to do? What's the first thing to do? Hey, so can't you tell me the first thing to do?
Hello, sir.
Yeah.
So I think you'd have to advise the patient to wash their hands to avoid contamination before they start the process.
Oh God, have mercy. So washing of hands is what is important here. Coco. Coco. Washing of hands is the most important. Shame on to the class. What is important?
Sir, please, sir, are you calling me?
Yes. What is important? The first thing. What is the first thing? What is the first thing? What is the first thing?
Sir, is it the process of doing the collection?
What are we talking about? We are talking about urine collection.
I was thinking that maybe you get some tissue and you do some wiping first before you start.
You wipe your mouth.
No. You get a tissue to.
And you wipe what? Hmm? So you are not thinking, Coco, you did what? But you cannot tell me you wipe it. You have small tissue and you wipe. You wipe where?
Maybe I wipe the tip of my distance before maybe.
Tip of your distance.
Yeah.
What do you mean your own? What do you mean? Coco, do you need lagato? Coco,
Yes, sir.
do you need lagato?
No, sir.
So tell us, tip of what?
The way your girls are happy. The way they are happy laughing.
My girls.
Yeah, they are sending signals behind the.
You want them to cry? Huh? Coco. Hey, the ladies cry for Coco.
They are crying, sir. They are crying.
Cry for Coco to be happy. Coco, I'm waiting.
They understand, boss.
Ask them whether they understand. Coco, ask them.
Please, do you understand?
No. No, please.
Oh, thank God.
No.
Thank God that they didn't. I wanted you to use words. You are a science student and you're the tip of what?
The tip of the
That is not what even I wanted you to talk about. Because of Adrian Bonnet, Coco. Because of Adrian Bonnet, you have to clean the urethra meatus. Clean. That is the first thing that you need to do. So you wanted to clean your hands first before. The first area is to clean. So if you clean your hands, The next way is to clean the urethra meatus. That is that. We don't want any contaminant. You clean that. Then Benedict said that you'll be taking the sample from the midstream. You're taking the sample from the midstream. So that you take them from the midstream. But let me ask you this. For older women, how can you go about it? For older women. Or women with vaginal bleeding. How will you go about it?
So please, I'm trying. You use a catheter. You pass catheter and collect the urine.
So you part. Okay, so older women and women with vaginal bleeding or discharge. So if you have vaginal discharge or bleeding, you have to get a specimen from catheterization. You have to pass the catheter and get the reason why we don't want the catheter is that there could be contaminant within. So we have to do that. So vaginal discharge and bleeding, you need catheter. In older women, you need catheter for that. So that is that. You can also do dipstick. Urine testing. You can do dipstick. And for the dipstick, for UTI, which parameters will you be looking at? Which parameters will you be looking at for UTI?
Leukocyte esteries.
So tell us more about that. Tell us more about that.
Okay, so when there is cystitis, that's inflammation of the bladder for urethritis.
Dipstick.
Dipstick.
I was saying urine testing. You can also do dipstick. And I was asking about the parameters. What are the parameters to look for UTI? You said leukocyte esteries. I said I want more information.
Okay, so leukocyte will be raised when there is inflammation of the bladder.
Leukocyte is what? Leukocyte is
present. It's present.
Mm-hmm.
As it will be positive when there is inflammation of the bladder.
There's inflammation of what?
The bladder.
How come that there will be leukocytes, esteries in the urine? This is what I want. Don't tell me when there's inflammation. How come that you'll be having leukocyte esteries in the urine? Who can help me?
Sir, please, when there's bacterial infection, the white blood cells will go there to fight the infection, so they will appear in the urine.
So the white blood cells would appear in the urine.
Yes, sir.
Bernadette, can I see
Sir.
your face?
Sir, please, my place is dark.
Your face is fair.
Sir, I'm coming. I'll show you my face.
Very good. Who can do it well for me? Somebody said when there's inflammation, when there's bacteria, infection, whether bacterial or co, will cause inflammation. I would just want to know how these leukocyte esteries will get into.
Yeah, so when the white blood cells are recruited to the site of infection, some of them will be undergo lysis, and that will result in the release of the leukocyte esteries.
Some of them undergo what?
Lysis. Some of them will break down. They will break down.
So when there's a breakdown, lysis, you want to say lysis. So when there's a breakdown, what will happen? What will happen?
So when there is breakdown, the leukocyte esteries will be released into the urine, and that can be detected during the urinalysis.
Mm-hmm. So where is this leukocyte ester? Where do you find the leukocyte esteries, and what is leukocyte esteries? Oh, hey, class, hurry up. Where do you have, Matthias? Where do you have this leukocyte esteries?
So the leukocyte esterases are enzymes that are produced by the white blood cells.
They are enzyme produced by the white blood cells.
Yes, please.
Hey, Matthias. Hey, wobɛki ka sɛ kyerɛ mu wɔ professional exams a wɔn de mɛyi akyerɛ mu. Meka kyerɛ me sɛ where do you?
We beg.
And what is we beg? Where is Coco?
Ade,
Where are you?
Ade,
Where do you have to clean? Matthias, tell me. I want you to get. There are certain things from afar you may think you know. want you to get the basis, and that is what I want. I don't teach for your exams. I teach such that it is part of your life. Anywhere that you go, you apply it.
So they are enzymes produced by the neutrophils.
Mm-hmm.
And then, so when there's an inflammation and then the WBCs are recruited to that site,
Mm-hmm.
the lysis of the WBCs or the neutrophils, and then they release these enzymes, the leukocyte esterase.
So leukocyte esterase are enzymes found in where? Found in the white blood cells. Benedict also moved to. So leukocyte esterase are different from what? Leukocytes. Leukocytes is different from leukocyte esterase. The esterases are enzymes found in the leukocytes, the white blood cells. So when there's lysis, there will be release of these enzymes, leukocyte esterase. So the dipstick will detect this, and that will be a positive thing. When you see leukocyte esterase, presence of leukocyte esterase, when you are doing urine testing using dipstick, then it's what? Then it's positive. Leukocyte esterase gives you a positive. What again?
Nitrate.
There will also be nitrate. What can you say about nitrate? What can you say about nitrate? What can you say about nitrate?
I think it has to do with the conversion of nitrate to nitrites.
Mm-hmm. I'm listening.
That is done by an enzyme in an acidic environment or something.
Or something.
Yeah.
What can you say about the nitrate?
Okay, so Dr. Attakorah,
Mm-hmm.
so please, with the nitrites, there are certain organisms that are able to convert nitrates to nitrites. And
Mm-hmm.
some of the other organisms too are unable to convert nitrates to nitrites.
Mm-hmm.
So you have certain organisms like the E. coli and then also Pseudomonas aeruginosa that are able to convert the nitrates to nitrites. So the appearance of the nitrites in the dipstick may give an idea of UTI, but it's not totally conclusive that the appearance of the nitrites would suggest UTI, but it can also help.
So can there be a UTI without presence of nitrate?
Yes, sir.
And Doctor, you are talking, I told you, now you have gone back to polish your face.
Oh, no, sir.
So
Because we were talking, that's why.
you have doom so.
Occasionally, sir.
So today you have doom so.
No, please, we don't.
Coco will get you. Coco? Okay.
Yes, sir.
Are you there?
I'm there.
Okay. So can you explain to me UTI UTI, can a patient come with UTI without seeing nitrite on the dipstick?
I think for that one it's age dependent. Normally in the elderly, there's a high possibility that you see this nitrite in the when you do the analysis. But in the young ones, normally it doesn't normally present. You wouldn't most all the time see the nitrite being present.
Question. So can a patient come with UTI without seeing nitrite on the dipstick? Yes, with reason. No, with reason. Hmm?
So when Matthias was talking, he mentioned that it isn't all the UTI causing organisms that are able to convert the nitrogen to nitrite.
Mm-hmm.
So in the presence of UTI, when nitrites are negative, it could be that the organism causing the UTI cannot do the nitrite thing. That's why it's negative in the urine.
Cannot do the nitrite things. What does it mean?
It's
I'm mindful about the way you answer questions. So I'm asking, can a patient come with UTI without seeing nitrite?
Dr. Attakorah,
Yes.
please, there are some organisms that are not able to convert the nitrate to nitrite. So
I am
there's a
saying, I am saying
yes.
Yes. Then you explain.
Yes.
No, you explain. Learn questions. At times, and a patient come with UTI without yes, then you explain. Because the yes will give you marks. Then the other explanation. Don't start. I'm listening.
Okay. So yes, but the why? How to explain the why? Because some organisms, let's say usually the gram-positive organisms are not nitrate converting, and usually the gram-negative ones are they can convert the nitrate to nitrite. So there could be a possibility that the UTI will be the patient will present with the UTI, but the nitrite will be negative, which means that the bacteria causing the organism will most likely be gram positive usually. And if it's positive, usually the organism is depleted as gram negative.
Yes. That is the answer. And you can continue by saying that the causative agent may not be able to convert the nitrate to nitrates. All microorganisms or bacteria, everything are converting this to this. So those organisms that some of the organisms may cause UTI, but will not be able to convert the nitrate to nitrite. So the nitrite is not definite, but leukocyte is definite. So when you don't see nitrite, don't say that your patient is not having it. When you don't see, please don't jump into conclusion that there's no. If you don't, you should all the time look for leukocyte steroids. Leukocyte steroids will now straight tell you is we have UTI. Okay. At times, others will also be doing cultures. Cultures are not really recommended in UTI. You can do it, but cultures are not really recommended. But you can still do it if you have. Wednesday, Matthias.
Hello, sir.
Wednesday, tell the class. Anybody joining should join with the full name.
Yes, please.
I want Abina Kojo. I don't want that.
Yes, please.
Join with if you take those names of Abina and Abina. What is Abina? So I just want to know the full name. My Zoom is
Please, I'm working on it.
how many?
Please, a minute. Let me check.
Who is a Rama? Who is a Rama?
Hello, sir.
Yeah.
Yeah, please. I sent a link to the page for them to fill, but not everyone has responded. The number on the page and then the number that has responded. So I have about 120 people that have responded, but the number on the page is about 140. Let me see, 144. So 142, excluding Dr. Ishak and Fambobo.
I'll be doing roll call. I'll be checking Wednesday. So be here with your full names.
Yes, please.
And I will let you be on. Your camera will be on. When I call you, your camera will be on. Some of you are in groups. I'm hearing these things. I've been talking about it. Some of you are joining through other. I told you if you have issues about this, just let me know. I hate these shortcut things. I'm trying to beat university. That is why I wanted to write books, short books. But the danger is your behavior. You get it. You will be doing photocopies. You think you have beat the system, and somebody also be beating you. You steal and go to the exams and you fail. This is our character. So the good thing in us, we cannot bring it up. Okay. So do that for me, Matthias. Tell them. class. You should. I don't want Koju at this. What is it? I want to get the full name. Be checking with the other social medias to check those who are stealing. How do you manage management of UTI? How do you manage UTI? Did you do UTI at school? Did you do UTI at school? How do you manage it? So UTI, urethritis. How do you manage urethritis? If a patient comes with urethritis.
So, doc, you manage the symptoms and then you treat the underlying infection.
So how do you manage it? So tell me, I'm asking you.
So with the if there is dysuria, we can give pain medications like paracetamol, and then we can also do so if the urine pH 2 is low, you can do the urine alkalinizers like mixed potassium citrates, or even there is a new product called Aka5. And then for the antibiotics, depending
What is
on whether
within the Aka5?
it's herbal component.
What is within Aka5? So in the examination, in oral, if you don't know, don't commit yourself. Do you get it?
Okay, please.
I am saying these things to you. You don't know. I keep on saying that your follow-up questions should be something that you can answer. Now, if you tell me there's a new product, I'll be interested to know the new product. So I'll be asking more questions. So if you want to mention the new product, please, I beg, know the new product such that when there's a follow-up question, it will be a problem.
Okay.
The clinical questions takes 15 marks. The highest way, 15 marks. The clinical question takes 15 marks, so be careful. The orals, the clinical takes 15 marks. Okay, so you use what?
So yes, so
can I ask
for
what causing the pH? The pH to be low.
No, please, I'm not sure.
Who can tell me why UTI? You are telling me the pH should be low, and therefore you use Aka5. So the Aka5 will do what? What would the Aka5 do?
To raise the urinary pH.
To raise the urinary pH. So it means what I'm trying to say is that all the time cause low pH.
No, not all the time.
So put it down and find out what could cause the pH to be low in UTI. Ismail, I'll ask you.
Okay.
You need to get to the basis such that when a question is asked, you know. Don't just be Don't just be taking things. What goes on? Why am I giving that? Okay, so tell me, continue.
So, with the treatment of the underlying infection, depending on the results that you obtain in the dipstick. So, if the nitrite is positive, then we can basically go for either the third generation, a coverage that will cover gram-negative organisms. So, either the third generation cephalosporins, or you can even do the fluoroquinolones.
So tell me,
So we can do
generalization. Is specific.
Okay, so we can do ceftriaxone. That's if for hospitalized patients, you can do the IV ceftriaxone 1 gram daily for like 5 days, or 2 gram daily for like 5 days, 3 to 5 days. For uncomplicated. We can also do ciprofloxacin.
For uncomplicated, you are doing what? 2 grams?
No, 1 gram.
1 gram.
Yes, please.
I beg. Check. I beg why? Check the doses well. You are becoming a pharmacist. Don't just. I don't like. I think in my. If you don't know, you find out. Don't just be quoting any doses.
Okay.
Don't just quote any doses, because when you do that, somebody will just pick it and check the doses. If you want to quote the doses, what again?
So we can do the fluoroquinolones. Ciprofloxacin 500 BD for 5 days.
Can I do azithromycin?
Yes, in some conditions you can. Yes, you can do azithromycin.
I'm asking, what is in some condition? Which condition? I'm talking about urethritis. Can I do azithromycin? And you're telling me in some condition. Which condition are you talking about?
Okay, so Doc, for the guidelines that I've read, I've not really seen azithromycin being used to treat UTI. So,
which guidelines have you read?
the STG and then
STG is a guideline. STG is a guideline. STG, I copy from other places nearby Lamputu.
It's a conventional guideline.
Yeah. Azithromycin, urethritis. Who can tell me? Can you use azithromycin to manage UTI, urethritis?
Yes, sir.
Yes. Ismail, listen to. Yes, on to lady.
Yes, I'm listening, Doctor.
Who said yes?
I also said yes.
Coco.
Yeah.
Docas. Docas or Coco?
I also said it.
Okay, so tell me. Ismail is telling me that the guideline that he has been using doesn't talk about azithromycin. He's using a classic guidelines, and the whole Ismail. Yeah, using guideline that will not talk about azithromycin. Can we use azithromycin to manage UTI?
Yes, please.
Tell Ismail.
You can use it.
Tell me more.
It has coverage. It has coverage for atypical organisms, which sometimes are normally implicated in some UTIs.
At which dose?
That's 1 gram, 1 gram, 1 gram of azithromycin.
Mm-hmm.
Yeah.
Are you done with the dose? The dosage regimen?
Either 1 gram or 2 gram. You can use 1 gram or 2 gram.
Either 1 gram or 2 gram. What to do? I don't want that gas. Coco. You have exams coming. When you get, somebody will pick it.
Yes,
Who can tell me, Doctors?
Sir, please, you do 2 grams once daily.
Which guideline is saying that?
Sir, please, I read it from McManor.
Standard treatment guideline.
No, sir.
No,
sir, please, I read it from McManor.
Read it for me to my hearing.
So I'm going to look for it. Sorry.
So should we see Doctors?
Sir.
Yeah, the church and you go fine. So azithromycin is used. Which other medication? Cystitis. Which other medication?
Cefuroxime.
Can you use cefuroxime to manage E. coli? If E. coli is the cause.
No, please.
Can you use amoxicillin to manage E. coli? So, can you use Septrin to manage cystitis?
Yes, sir.
For how many days?
3 days.
For 3 days. Can you use fluocinolones for cystitis?
Yes, please.
For how many days?
10 to 14 days.
So it's 7 to 14 days. Can you use nitrofurantoin? When do we consider nitrofurantoin for management? Do you use it in pyelonephritis or do you use it?
It can be used in cystitis, but it cannot be used in pyelonephritis.
Can be used in what?
Cystitis, but it cannot be used in pyelonephritis.
So why?
Because I think in pyelonephritis, the infection is at the upper part of the, what do you call it, the bladder. That's the ureters. The ureters are involved with the infection. So those organisms normally that are implicated there, when you use the, what do you call it, the nitrofurantoin, they are not effective. They are not able to get the lesson that you want to achieve. the effect you want to achieve.
I asked more questions. I want to see the way you answer questions. I could have been saying this and leave. I want you to know the way you answer questions and you correct them here. Do you get it? Do you get it? So why is it that you said we can use nitrofurantoin in what?
Cystitis that cannot be used in pyelonephritis.
I want the reason. Tell me the reason. Proper reason.
Sir, please, nitrofurantoin does not penetrate the renal tissues well.
I'm listening.
That is why it is not used in pyelonephritis.
I want you to do more. You started it well. I want you to do more about the reasons.
Okay, so it concentrates more in the urine more than the kidneys.
What?
Nitrofurantoin.
I
said it concentrates more in the urine than the kidneys. So it achieves low kidney concentration. So it might not reach the MIC needed to inhibit or kill the bacteria in the kidneys.
So you are now. So Jemima.
Hello, sir.
Tissue penetration for nitrofurantoin is poor. Concentration is in what? In the urine. So it tends to affect the organisms in the urine. So if it's pyelonephritis, if it's in the urine, then you'll be getting nitrofurantoin. You get it?
No, sir.
Huh?
No, sir. I didn't get it.
No, please.
I am saying that tissue penetration is poor when you consider nitrofurantoin. Huh? And the urine concentration for nitrofurantoin is high, and therefore it could kill the microorganisms in the urine. That if it has to go into the tissue, it can't. There's poor penetration into the tissue. The parenchyma cells of the kidney can also, pyelonephritis, you won't get it. But if it's in the urine, the concentration is high in the urine, not in the tissues. It's not like azithromycin. Azithromycin could be in the tissues. And therefore, if it's atypical, you can use it in pyelonephritis. Benedicta, I'm talking about concentration in the urine and concentration in the tissues. You get it?
Yes, sir.
And I'm saying that nitro has poor penetration to the tissue.
Okay.
Its concentration is high in the urine.
Okay.
And therefore, microorganisms in the urine could be cleared. That is why I'm talking about cystitis, which if there's inflammation, it would affect, and therefore, either more urine will be accumulating over the urethritis. So that is that. Can you use doxycycline to manage UTI, especially urethritis?
Yes, sir.
So why doxy? Hmm? Hmm? Tell me, Dogsy, what will Dogsy do?
Sir, please, I think it will target the gram-positive bacteria involved in
Dogsy,
UTI.
Dogsy will target gram positive. Mm. Doxycycline. Doxycycline. Uh-huh. Hey,
So doxycycline is a broad spectrum, so I think it will cover both gram-positive and gram-negative organisms involved in UTI.
so tetrazine is not broad spectrum.
So it is, but it has less activity against gram-positives.
So doxycycline has equal activity against gram positive, gram negative, atypical. Mm. It has equal activity against all. Mm. Any question? I'm done with the UTI. Any question? If you don't have any question, then
Doc, please, I have a question.
today.
Doc, please, how is azithromycin taken?
Mm.
Please, how is azithromycin given for the UTI?
So what we use azithromycin for? Which organisms was azithromycin target?
Atypical organisms.
Atypical. Mm-hmm. Why atypical organisms? Why do you consider? So can I use azithromycin to manage microorganism or cell wall? Can I use that? Bacteria. Hmm?
No, sir.
Why? I want the reason.
So the atypical targets organisms that do not have cell walls.
You don't have cell walls. So, and another advantage of azithromycin is that they could stay in the tissues for long time. Advantage of considering UTI for urethritis is that they can stay in the tissue for long time. So if it's caused by atypical organisms, so other organisms could also cause UTI. Gram positives. When we started, I mentioned gram-positive organism that could cause UTI. What is that? What is that?
Is it strep?
Intestinal staphylococcus.
Coco, you said what? Is this strep? You're asking me. Is this strep? I'm asking a question. You're asking, is this strep? Well, how come I show my body say? Go and sleep, one. Go and sleep.
Dr. Attakorah, please still on the azithromycin.
Hello?
Hello, doc. Please, I wanted like the dose and then the duration for UTI.
Hello? Ejapoma? Hello?
Yes, doc.
I was on the phone, sorry. You said what? You want the dose?
Yes, please.
I shouldn't answer you this question. You want the dose of what?
Doc, please, I beg. I've not seen it before, that's why. The dose of the azithromycin and then the duration.
Hey, God, have mercy. If you want to give us azithromycin, even under normal way, what is the dose?
It's
And what is the
500,
duration?
500
daily
grams
for
daily
3 days.
for 30
5
days.
days.
When you want to do it for UTI, what do? You do 1 gram daily for 3 days. I shouldn't have answered you this.
No, doc, I'm sorry. Thank you.
It's a shame. These small things you don't want, you should look for. Yeah. We said azithromycin, you haven't seen, but we have mentioned it to you and want the dose instead of you searching for. The more you search, the more you get information. Because you have gotten the dose, you not look for. Oh, okay. Hey, Unkoda, go and sleep.
Doc, we are sorry.
I'll be meeting you. I'll be meeting you on Wednesday. I just want to finish and then say, I don't want to solve questions with you guys because I cannot trust you guys. Because when it will be like, hey, people are waiting. So I just want to finish what I want to do. Have you done irritable bowel disease?
No, please.
No, please.
What I'll do, the next topic will be poisoning. I'll do poisoning with you. Certain poisoning, I'll do with you. Then I'll do it. Okay.
So, we haven't done the cardiovascular condition.
Which cardiovascular condition?
Angina.
Hey.
Arrhythmias.
Hey. Is it angina or arrhythmia?
The both.
Having done angina with you, coronary artery disease.
No, please.
Class. So the cardiovascular, tell me the topics I've done with you.
Heart failure.
Mm-hmm. Only heart failure.
Yes, please.
Why are you, Matthias?
Hello, sir.
Tell me the topics I've done under cardiovascular.
So we've treated heart failure with you, and then we also did hypertension with Fambobo. So those are the only topics that we've done for the
You didn't
cardiovascular.
done coronary artery disease.
No, please.
That's a one. Bye-bye. Yeah. Okay. I'll see you on Wednesday. Bye.
Bye.
Bye.